started recording po with your permission. So ano na lang po. We also had problems with Zoom prior sa balikan po dito sa ating after the Holy Week. So I hope you did not encounter that. And ang aking laging pine-preserve dito is yung recording. So previously I have recorded sa cloud. Ngayon po kung nagre-recording kayo in your other courses, mag-record na lang kayo sa computer niyo kasi nawawala po. And have no way of using that as reference. Kasi di ba kung may na-miss kayo, you usually go back to the recording. So ngayon po I'm recording. Ang detriment po kasi sa recording to your computer is the nagja-jam pack naman yung iyong memory. So hindi naman po syempre ako napaka-extensive ng aking memory. So naka pa rin ako external drive. Medyo matagal kasi ito pag ina-upload mo rin at kino-convert. Sige po, ngayon po ay ang pagtutuunan natin ay public health ethics. So we have entered already the third unit. Natapos na po tayo sa health and development. Yan po yung mga natapos natin. Health and development, the social determinants of health. Natapos na rin natin yung systems. So familiar na kayo sa blocks, how they interact, and systems thinking, as well as a little bit introduction to health policy and how to analyze policies. The whole policy po is actually a long journey po yun. Mahaba po yun. It's actually a postgraduate course. Postgraduate, yes. Degree. Along with our MHA and MPH. In-sponsor din po ng department natin. Ang head po doon si Dr. Myra Silva. I don't know if you have encountered her in your other subjects. And you might want to look into that. Yung aking ginawa po sa inyo, don't mistake it. Dinigest ko lang into 2 hours na lecture just to fit what you would be needing if you plan to undertake an advanced course in it, or if you plan to do something, a little bit of policy analysis in the future. Pero ano po yun, napakahilaw. Hindi po yun yung lang siya, FYI lang. So yun ang disclaimer ko. Baka akala nyo kasi pagkatapos nun you're already experts in health policy analysis. Hindi po. It's just an intro. Hindi pa po siya yung the real thing. Now I will be sharing to you my public health ethics. So we touch on management. But before I begin my management lecture kasi I usually begin with public health ethics. So I hope you could see the slides. Nakita po ba niyo yung slide on public health? Malinaw po ba?
Yes po.
Okay. Confirmation lang po. Thank you for confirming. Ngayon po I see just 3 people. At usually ang faithful po lagi yung mga women. Hindi po faithful ang mga guys. Kasi hindi naman sila makita rito. Si Alvin po kasi kanina absent din sa aking morning session. So, we will be explaining and defining ethics, what it is in the public health context. Explain the common, actually 7 po siya, public health ethic principles, and provide a case example with a detailed checklist of the 7 public health ethical principles. And then again, after the lecture is nothing if you do not understand and is able to apply it in real life situations in the health sector. So may mga magiging ganyan din pong questions. So what better way to learn about it but through not only the definition but a real life application example into it. So usually ano po ito, checklist. But for now, when they ask you what ethics is, what words come into mind po ba? So ayan, pwede niyo po bang puntahan ito, itong Bitly Ethics EF? Pwede niyo po bang puntahan sa inyong Bitly Ethics? Type niyo lang po. Tapos kung may makita kayong questions, ika-capture ko po kasi yun sa word cloud. Meron po siyang automatic word cloud. So every time I present this, pumupunta po kayo sa ano ba yan? Nagde-develop ako ng word cloud na anong itsura ba ng iba-ibang batches, kung ano yung kanilang perception on that. So Bitly Ethics EF. Ewan ko kung saan kayo dadalhin yan. Ewan ko kung makiklik. Ay, hindi pala makiklik. Tinatry kong dalhin kayo. Teka, kokopyahin ko. Pero sana ma-type ninyo, HTTPS. Automatic nagka-capitalize yung aking HTTPS eh. Bit.ly, para lang madala kayo doon. Ethics, EF. Ayan. Tingnan ninyo kung matatype yan and if it will take you somewhere else. I typed it in the chat box. Stop share ko muna ha. I'll stop share and see if it will take you there. Have you tried clicking it? Did it lead you? Ayan. What words come to mind? If when you hear the word ethics, pwede nyo po paki-fill up para lang makapture ko kung ano yung inyong nasa sa loob. Kahit tatatlo po kayo. So I'll try to see what it is. Sige, my presentations. Yan. Sige, tingnan natin. Ginagawa nyo na po ba?
Yes po.
Okay, titingnan natin. Sige po, ang mga nakikita ko po ngayon ay ano po yan? More than 3. So, ang medyo malaki, tatry kong i-share sa inyo. Tatry kong i-share if you could see it from this side. Tingnan nyo po kung nakikita nyo. Nakikita nyo po ito? What words come into your mind
Yes.
when you hear the word ethics? So, ang medyo malaki po is moral principles, doing the right thing, right or wrong, yes, what is the right thing to do, and conversely, ano yung other side, and then conscience. Ang pinakamalaki ay moral principles. I think you are all correct there. So, ito po yung malaki. Oy, may pumapasok pa. Medyo tumataas yung may sumingit, pero pinakamalaki pa rin. Since this is a word cloud, so word cloud po, ang pinakamalaking word at sumesentro, yun po yung parang sinasagot ng mas maraming tao. 3 lang naman kayo dito sa class. So, moral principles. Secondary, merong standard, doing the right thing. Maliit na yung iba. Siguro the others answered just once. Yung medyo nadodoble-doble is the moral principles. So, stop sharing po. Just to tell you na in the other class naman, I think I have that. Ito po yung sagot nila. So, in the past, they would say principles. Nandun din po, values, moral principles, acceptable actions, a little bit of habit, moral. First, do no harm. And then, of course, some of the principles already appearing. Non-maleficence, beneficence. Yan po yung po kasi mga principles na along the lines ng 7 nakikita natin. Sige po. Meron lang mga sumisingit habang ikaw ay nagde-lecture. Okay, sige. Ako may ano na daw, may patient nasa clinic. Ay, sus Maria. Sige, may klase pa. Okay. So, yun po yung what we could see, words that come into mind when you are asked what ethics is and why is it relevant to bakit itinuturo dito sa Public Health Administration? Because it needs to be emphasized also. When you say ethics po, it's derived from the Greek word ethos. And it usually refers to character, guiding beliefs, yun, sabi natin, standards, ideals that actually predominate in a collection of people. So a community, a group. In the present context, ethics is used in 2 ways. So it's a field of study and it is also a behavioral pattern. If it is a field of study, it is a branch of philosophy which is concerned with human moral character and conduct. So, meron tayong mass moral principles that define what should be. And as a behavioral pattern naman, it relates to behavior that is ethical. So what is acceptable? What is it that, prevails to us? So it's not culture. Ang culture kasi could be good or bad. This one is usually moral. So meron siyang common good aspect. So, but what is public health ethics? Why do you apply it to public health? So, as with the concept of public health, there is no settled account of the moral concepts and methods. But systematic efforts, there have been authors who tried to articulate principles, ethical principles and frameworks to guide ethical inquiry in public health. Marami po ito since the beginning of the late 1990s towards 2000, early 2000, 2002, 2006, 2007, 2008, and lately yung 2013. So those authors that are mentioned here identify a number of general moral considerations which include producing benefits, not exclusively health benefits, but often interpreted in health policy as a utilitarian commitment to maximizing aggregate health benefits. So, ano pong ibig sabihin nun? A utilitarian commitment. Ibig sabihin, it's something that everyone, each member of a particular community are able to benefit from. So, in as much as health is considered. So, and it did not really be exclusively health. It could be education, it could be shelter, it could be peace and order, it could be the kind of governance of where you are or where you live in. So, yun po ang ibig sabihin nun. It produces benefits, but not exclusively health benefits. And it also is there to prevent harm because it's health, so it could be associated to a health harm, such as a preventable morbidity and premature death. So that you do not, dahil public health po tayo, the tendency is also not just to avoid premature death, but prevent you from getting sick in the first place. So all of those things, all of those factors, whatever you can think of, contributing to that. So sinasabi dito, hindi naman siya exclusively health-related. But if it leads to healthy benefits or health benefits, then yun po ang ibig sabihin natin. Those are the ethical principles and frameworks that guide us to the ethical inquiry related to public health ethics. And also, it is distributing these health benefits fairly. So wala po doon sa membro ng ating community, society, town, municipality, or barangay na nakakatanggap or receives it more than we do. So it's distributed fairly, and there is actually distributive justice. Distributive justice actually in itself is also a type of public health ethic principle. So the fair distribution of social goods. It is also procedural justice. There is fair process. Everybody is participating. It's not something that, just is dumped onto you as a matter of service. So sometimes the local government is guilty of that, just dumping to you without asking you, is this really what you need? Because that is part of the participatory and a hallmark of primary healthcare as described classically in the Alma Ata document. So, real primary healthcare is participatory. It's also transparent. So, everybody is able to see. Pag sinabi pong transparent, from the one who created it, from the one who developed it, to the one who will be receiving it. Before pa niya ma-receive yun, there have been probably, at least the assumption is, there have been probably many meetings, many consultations that happened before they were finalized and implemented. Before they were implemented, a lot of processes have I mean, it has undergone a lot of revisions, consultations, deletions, and to the form that it probably is being implemented, it is already very much refined already. So it has undergone a certain process in order to make sure that that type of yung the one in the bullet number 4, procedural justice, has been demonstrated. Okay? And it is also respecting individual autonomy. So much like your vaccines, before in the first year of the pandemic, wala pong vaccine. So we were all doing the so-called NPIs, non-pharmaceutical interventions, which is actually time-tested already to be effective. What is that? Quarantine. Yan, panahon pa yan ng ano noon, ni Edward Jenner. Kung kilala niyo po si Edward Jenner sa history, wala pang vaccine. So mag-ano muna tayo. Anything that you do not come into contact with, transmission is cut. You will be safe. Basta wala po tayong contact. Infectious disease ba ang usapan? Wala pong contact. And anything that prevents that physical contact, whether it's a mask, a face shield, or social distancing, that's very effective. So wala pang usapan ng gamot. Wala pang usapan ng anything you take orally or intramuscularly, which is the vaccine. Wala pa yon. So because the reason for that naman is it takes time to develop medicine. It takes time to do research for our scientists to come up with several experiments pa, procedures, and as a matter of regulation, we have certain phases before a medicine vaccine is accepted by our different countries have their regulation agencies, usually called the Food and Drug Administration, their FDAs, and of course some more progressive countries who do now universal healthcare, their UHCs in place, have their HTA councils, so-called HTAC councils, their health technology assessment on what works and what does not work. So it respects individual autonomy in the sense that if it has not reached that particular phase yet of being marketed, being used to humans, okay pa lang pala sa mga animals, pero hindi naman okay sa mga tao pa, you can exercise your individual autonomy. Again, it's another principle and liberty of action, not to partake. So that's why you have a group of people who, up to now have no, they do not want to partake of the vaccination. It's not largely because they do not trust the process. It's actually, baka yun nga yung reason. They trust the process. And the process is clinical phase 1. May phases po kasi, phase 1, phase 2, phase 3, phase 4. Before you get into the actual marketing of the medication and prove it to be effective and safe for everyone. Baka they trust the process nga too much that they would like to see it followed. And that's why you were also introduced during the pandemic into another new term. It's called EUA, Emergency Use Authority, which I think in its provision, and the government had problems with that, has to have parang an insurance that in cases that there be side effects which might lead to not just morbidity but fatal deaths, mortality, there will be no lawsuits, there will be no legislative action taken against the pharmaceutical manufacturers who gave the medicine or the vaccine. Kasi nga, we're under emergency use authority. Yun po yung EUA. Kung meron man, meron dapat indemnity fund which should be sponsored by the government, being the one trying to administer it. So, yung individual autonomy means, yes, I know you mean well. Yes, I know you have your emergency use authority. Kaso experiment pa rin yun eh. It's actually parang, giving you the choice of of taking that medicine versus not taking it. So, of course, you have been informed of the pros and the cons. Pero in cases that you have been na-explain sa'yo and then you still do not want it, yun po yung respecting individual autonomy. Because I respect. And I know of several doctors, colleagues of mine. Actually, even in our department, we have colleagues who would rather not. And even not only in UP Manila, I know of several colleagues in UP Diliman, other campuses of UP. Doctors po to, matatalinong tao. And even non-doctors, not necessarily a doctor, but they would rather not get vaccinated. Not because they do not trust, but actually I think they do trust it, that they would like to see the process and really from, the real process, nasa phase na ba tayo. And then they will take it after they have proven that it really works and it's safe. For the meantime, they're exercising NPIs. They know all the risks that come with their decision. And there's also respecting and fulfilling universal human rights. So, iba-iba po ito ha. Itong respecting individual autonomy sometimes may run counter in the examples that might be given per each autonomy and exercising human, they might run counter with each other. Pwede po magka-kontra yung autonomy doon sa human right. Autonomy is I do not believe in it, I will not wear a mask. Kasi recommendation lang naman po yun eh. In other cases, it is also mandatory. Ibig sabihin, hindi ka pwedeng pumasok ng restaurant, or kung wala kang vaccination. So it's my right also not to, if I exercise my right not to get vaccinated, not to wear a mask, then the restaurant or whatever it is, could be a restaurant or any other, an office, also has the right not to accept you. Kasi ganun kasi yun eh. Medyo meron silang conflict ng konti. Pwede ka rin nilang ayaw kanilang papasukin. They will prohibit you from entering because they do not want their other constituents to be ma-endanger ng iyong presence. You know that if you're not vaccinated, then there's also a probability of you having the disease. We do not know that you have the disease, and you might, we can contract something from you. So that's also part of the protection. So may mga overlaps po ito. May mga overlaps po itong dalawa-dalawa na ito, tatlo-tatlo na ito. At pwede pong mangyari, kaya lang malinaw, it is clear sa iyong understanding what those overlaps are. Tiny or small as they may be, dapat aware po kayo doon. What else? So respecting privacy and confidentiality. So yung pag-exercise ng autonomy po also is has something to do with being private. So it's my decision. You should respect it. If I do not want to get vaccinated, much more getting boosters. Kasi kung hindi nagpa-vaccinate, lalong hindi magpapa-booster. But they will not, they must at least exercise quarantine procedures, which means not mingling with us who have been vaccinated. So yan po yung mga consequences depending on the case given. Anong case ba? Magandang example lang kasi yung COVID-19 because sometimes it produces all the principles, the overlaps that, a teacher like me would like to tell you in the process of me wanting you to learn these basic principles. Okay? So there's also respect of privacy and confidentiality. There is also protecting non-dominant subgroups from marginalization and stigmatization. So, yung mga hindi nagpa-vaccinate, parang nai-stigmatize sila. So, yung hindi ayaw ring mag-wear ng mask, parang may nagsasabi. Actually, there have been cases of violence in the United States, I think in Europe, that run along these cases. I don't know if you've heard of it or if you read it in the news reports, but there have been cases like those. And in the United States, where it's usually a different law from another state, depending on which state you are, kasi iba-iba nga po silang, masyado silang devolved. nagkakaroon din po ng ganyang mga conflicts and arguments about these things. The important thing is that you're able to articulate and analyze when it is put before you. So if it is a case and there is a question being asked, you're able also to answer the question correctly. And then there is also the case of building and maintaining trust. I think it's I mean a common thing yung I think yung vaccine trust, vaccine confidence, nagiging I think it was a byword already and many were using it because I think other vaccine programs, not really COVID, has been also affected because of this mistrust among the vaccines and iba pang usapan po yung mga na-vaccinate daw tapos nagkaroon siya ng side effect, worse, namatay or nag-develop ng iba. Meron po mga bagong lumabas ngayon na article sa Lancet and I think sa British Medical Journal about confirmed side effects of both the mRNA vaccines, both Pfizer and Moderna, which previously we thought are the more effective ones and which our health ministries, regardless of which health ministry you belong to, have been saying na the side effects are minimal. It's just the usual fever, the usual soreness of the deltoid area. Pero hindi gaanong na-highlight yung mga nako-confirm among studies that some of it can really cause serious side effects. So building and maintaining that trust, but trust is really difficult to create, especially between local government units and their constituencies. So ang ating pong dinidebate ngayon is hindi kung tama o mali. Ang ating dinidebate ngayon, ang ginagawa po ni Doc Emer ngayon for you is actually to help you tease out these issues. I'm actually helping you to be able to articulate and see which is which one is making an overlap on the other one. But we are not here to say that this is correct, this is right, this is wrong. Hindi naman ganoon. Ang hinahanap ko lang po sa inyo is you're able to identify what autonomy means, what privacy and confidentiality means, what do you mean by marginalization and stigmatization. Dapat alam mo po yun. When encountering such things in actual life, yung real life, and the example that goes with it, whatever the health case might be, dapat alam mo po yun. Yun po yung lang. Actually, yun lang yung gigradean ko sa inyo. And then measures to protect and promote public health often raise questions about the complex relationship between the state and the lives of individuals and communities. There is actually a substantial body of work about the relationship between the state and the individual. Are you more libertarian or collective political philosophies? And then there's a field of bioethics that has also become increasingly important. But much of this work discusses ethics at the individual level. Pag public health po kasi laging collective. You deal with a community, you deal with a group of people. Public health professionals are frequently called upon in daily practice to make both explicit and implicit choices that extend beyond the objective, the practical, and into the contested, and of course, the ethical. So dapat naiintindihan nyo po yan at masasagot nyo po yan. Balancing and coming to conclusions about the rights, the duties of individuals, communities, and populations with regard to protecting and maintaining health is in many ways the central and deeply complex task of public health work. Yan po yung context niyan. So, hindi po maaaring matapos ang inyong public health career na hindi kayo makaka-encounter ng mga ganitong katanungan or conflict. Baka nga po kayo pa yung i-consult. So, dapat po ready po kayo, you're equipped at least partially with principles and concepts learned from a lecture like this. So there are 7 public health ethical principles that you must learn. So my reference actually, you could see the Schroeder-Bach et al. Article. So this is actually about teaching 7 principles for public health ethics towards a curriculum for a short course on ethics in public health program. So this is actually published in the BMC Medical Ethics Journal. It's open access, so you could actually see it. So first principle is non-maleficence. I do not mean you any harm. Do no harm. It's, I think, in the Hippocratic Oath, if you're a doctor, if you're a physician. So it asserts that a healthcare professional should act in a way that he or she does no harm, even if her or his patient or client requests this. So if you see that it is really going to cause that person, that patient harm, you do not do it. Primum nil nocere. So the principle is that is the first to be proposed because of its historical antecedents. So sabi ko nga sa inyo, it comes from the Hippocratic Oath. An example is banning smoking in public places because it might cause harm to individual smokers. It will produce greater harms and arguably produce benefit through acting as a general disincentive to smoking among the wider population. It is also harmful, yung smoking, second-hand smoke, as you know, is more harmful than first-hand smoke among people with existing respiratory conditions and pregnant women. So, hindi po siya maganda. And if it's sustained, meaning it happens daily, there is a build-on accumulated bad effect which will prove harmful not only to the mother but also to the born child of that mother. Then there is the opposite of that, beneficence. The distinctive difference between beneficence and non-maleficence, on the one hand, is that beneficence lies in the fact that the former usually involves the omission of a harmful action. The latter, this one is an active contribution. So yung non-maleficence is I prevent you from getting this bad effect. Beneficence naman is you actively intervening in a particular situation to produce a good effect. So whatever it is, ano ba yung good effect mo? You're promoting physical activity for everybody. Beneficence po yun. Kasi for everyone. Public health po ha, hindi po tayo individual. We deal with groups of people. So yun ang isa sa main difference ng public health ethics. Now, there is also so-called health maximization. Ano naman yung health maximization? One way of conceiving the moral impulse of beneficence is to parang itodo mo na. Therefore, to understand the ethical imperative to produce benefit in a wider sense. To talk of the obligation of social beneficence. So public health individuals, public health professionals have an obligation to maximize health in the populations which they are responsible. So if you're going to introduce vaccination, vaccinate na po natin yung pinakamaraming tao. You could prioritize in order of, the most exposed frontliners, and then yun nga, yung ating seniors, much what like the IATF did. But you have to come up with a wider sense of producing benefit. So, health maximization po ang tawag doon. Another principle, ito palang maximizing health maximization is also on the principle of the common good. Sabihin, mas marami magbe-benefit. Whatever you understand by the good of many, di ba yung gano'n? For the good of everyone. Yun ang ibig sabihin ng health maximization. Okay, then there is efficiency. It actually, there will always be more health need than resources to deal with that you need. So, less ang resources. So, you have to be efficient. So, less resources to the the right people. So literally, all public health systems and healthcare systems lack resources. So you have to the use of ito sinabi ko kasi scarce limited health resources must be used efficiently, and it's a moral duty. So dapat na-emphasize po. So the duty exists at least partly because efficient use will enable public health professionals to produce more health benefit for a greater number of people. Again, it looks back to the other one, health maximization, kasi nga greater good. So related po yung efficiency din dyan. So produce more health benefit for greater numbers of people. Then you have the respect for autonomy. 1, 2, 3, 4. Ayaw namin. Dapat igalang mo po yun. Every person has a high value. Her or his autonomy cannot merely be treated as a means to the end for others' good. So yung argument mo na, yes, for the greater good, magpabakuna ka na. Much like the Department of Health is also doing. Kailangan po mabakunahan lahat. Kailangan po, ano po yan, less naman po yung side effect. Hindi naman po. Ayaw ko pa din. Ano po yun? Magagalit ba kayo? Kukulong mo ba siya? Anybody who is actually imprisoned, detained because of that, you could always argue for respect for autonomy. So, ang usual na example na binibigay po dito yung mga Jehovah's Witness, 'di ba? When they have an accident, a vehicular accident, and then they want one of the things that, if there's a hemorrhage, a bleeder, kailangan mag-transfuse tayo. Ayaw nila nung transfusion kasi it goes against their faith, their belief, their religion. Ang tawag doon po ay kailangan igalang mo po yon. Respect for their autonomy. Anong gagawin mo ngayon? Dapat you have to be creative as a health provider. You must have alternatives. So dapat may expander ka, may crystalloids ka, order ka maraming NSS, galang mo. Yun yung parte ng paggalang mo. Kailangan mo pa ataasin ang blood pressure. You have a falling blood pressure, hypotensive na yung patient kasi nga may bleeder siya, nag-hemorrhage siya, o marami, nawalan lang siya ng dugo. We were able to, sabihin, nasa ER na tayo, nasa ward na tayo. We were able to cauterize. We were able to stop the bleeding. But still, ang baba pa rin ang kanyang blood pressure. So paano mapapataasin? Ayaw magpa-transfuse kasi nga against. Respect for autonomy po yun. Again, you're confronted with that. Ayaw niya kasi nga will be violating his or her own faith. So what you do is come up with other instances. And of course, papipirmahin mo po siya na available po yung blood, meron po tayong enough blood, lalo na kung O positive, which means compatible naman siya sa lahat. Pero ayaw pa din, then you have to do something. Despite this, however, the tension between individual rights and broader conceptions of public benefit is a profound one for the public health as a field of practice. That is true. And then there is justice. Demands equal opportunities. So marami pong maghihingi sa iyo ng tulong at health-wise, marami talagang ikaw dapat maitulong. This is often discussed in terms of public health as a health equity. So what is justice is actually the fair distribution. Daniels in 2008 considers health equity as a matter of fairness and justice. Health inequalities are unfair and unjust and thus in conflict with health equity. If the socially controllable factors that lead to health are not distributed in such a way that the health of all citizens, ibang greater good nga po, is protected or restored as much as possible. So dapat po there is a fair distribution. Yung justice, there is no one left behind. Justice is usually has something to do with fairness. And of course, looking at the inequalities. Number 7, proportionality. So 7 na tayo. It demands that in weighing and balancing individual freedom against wider social goods, considerations will be made in a proportionate way. According to Childress, proportionality is essential to show that the public health benefits outweigh the infringed general moral considerations. For example, you might breach autonomy or privacy and have undesirable consequences. But the positive features and benefits must be balanced against any negative features and effects. So, ano po ito? Cancellation. Ibig sabihin, if you have to balance between the goodness, seeming good or seemingly bad consequences of several interventions, you have to at least make sure that the positive, ito yung last yung may check, the positive features and benefits must be balanced against the negative features. How do you do it? You list it down. And then tingnan mo talaga in a list para makita mo. Hindi pwede yung iniisip mo lang tapos sabi, oo nga, ganun nga. Dapat kasi meron kang checklist and you have to see na balance nga yung positive and negative. So ito po, may case po ako dito, the case of Bea Alonso sa hypothetical. So, Dr. Bea Alonso, so application na po tayo kasi natapos na natin yung 7 principles. Bea Alonso is a DPCB means Disease Prevention and Control Bureau. Marami po yan. It's a branch office of all ministries of health around the world or our Department of Health. So meron din po tayo yan, DPCB. Of the Ministry of Health of Country X is asked by her minister, which is the Secretary of Health in our case, to make a suggestion if measles immunization should be made mandatory in their national capital region. As recently, nagkaroon ng outbreak or 214 children died after a measles outbreak. So, tinatanong na kung pwede ba natin gawing mandatory yung measles immunization. So, what would Bea Alonso do? Country X has an insufficient immunization rate. So, the first dose was 70% and the dose was just 45%. Mababa po yan. Bea finds out what obligatory measles immunization. So, that's the decision point. Magkakaroon ka ng obligatory measles immunization. Is it effective? Nakita daw niya na in Hungary and the Czech Republic, effective naman siya. She knows the president is taking her advice more seriously. What should she do? So this is an example of an ethical problem. Pwede pong ganyan po ang ibigay sa exam. You must be able to answer this according to the 7 principles which I asked. How? By asking also the correct questions and producing a checklist. So yun, tinuturuan ko na kayo paano sasagutin. So ito po, tatry po natin sagutin yan using this. So yung 7 principles, di ba? We started with non-maleficence. So yan, you have to have some checks. Will no one be harmed? So it's actually essentially producing questions under each principle. Will no one, yun po yung checkan sa inyo. Will no one be harmed by the proposed intervention? Are special, so you have to know how to craft the correct questions under each public health ethics principle. So if it's non-maleficence, given this Bea Alonso case, ano yung mga questions? For non-maleficence, will no one be harmed by the proposed intervention? Are children specially prevented from harm? Imagine yung non-maleficence po is the prevention of the bad effect. So example natin kanina was smoking. So non-maleficence is not producing, do no harm. So pag binigay mo ba yung proposed intervention mo which is obligatory measles immunization, will anyone be harmed? So ganyan. Treat that as the obligatory harm. Yung obligatory immunization. Beneficence. So, isipin mo naman, baliktad, kabaliktaran ng maleficence, yung beneficence. So, you're going to introduce it as a good intervention. So, is the intervention of any good to every single person taking part? For both maleficence and beneficence, is it possible to assess whether more benefit than harm is produced by intervening? and or not intervening? And if so, what side of the benefit does the equation finally fall? So yan, yung mga sasagutin mo po yan bawat isa. At ito rin yung hahanapin ko sa inyo, yung mga tanong na yan. So pakitandaan nyo po yan, ha, pakitandaan nyo kung paano i-phrase given again the Bea Alonso case. Bea Alonso case, ito pong lecture na ito is actually available already in the PDF file where you can find this in the module tab of our HPAD 201 in Canvas. Ang non-available na lang po doon is the recording right now kasi it takes time nga for the recording to be converted. Next, health maximization. Is the proposed intervention effective and evidence-based? Does it have a sustainable long-term effect? Is there a community added value to the proposed intervention? Di ba yung health maximization is the kailangan lahat, yung goodness of all. Efficiency naman, on the other hand, is about limited lang yung aking measles obligatory. Oo, meron akong measles obligatory mandate, pero kukunti lang yung aking measles vaccine. So dapat, is the proposed intervention cost-effective? You should be aware of the public money. Saved money can be used also for other goods. Yun po ang efficiency. And then respect for autonomy. Does the intervention refrain from employing coercion? Sapilitan po ba talaga ito? Or does it foster free choice? Nilagay mo na nga mandatory. Di walang free choice. Is there really informed consent? Meron ka bang informed consent? Is there self-responsibility not only demanded but also possible for every person? Are privacy and confidentiality respected? If the intervention is paternalistic, is this justifiable? O yan, magandang tanong yan. Paternalistic kasi yung approach na ganun. Anything that is mandatory, I think, is paternalistic. So, feel free also to argue with me and the class if you have a different idea. Does the intervention promote the exercise of autonomy? Ayun, pwede bang tumanggi ang mga tao kung ayaw nila, lalo na sa kanilang mga anak? Yun. So, for justice, ito, several questions. Remember, justice has something to do with fairness. Is this publicly justified? Is the ministry acting transparently? Is the proposed intervention not putting some populations at risk from being excluded? Meron po bang mabubukod? Meron lang particular section na makakatanggap? Does the intervention exacerbate social and health inequities? Does it fight inequalities? Does the intervention consider and support vulnerable subpopulations like migrants? So some people are not really members of your community, but from other local government units. Are they considered? Are they included in your program of mandatory vaccination? Does the intervention promote rather than endanger fair equality and equality of opportunity in participation in social action? Does the intervention refrain from eroding a sense of social cohesion and justice? Again, sinasabi ko po sa inyo, ang pagdidesisyon ay pagpuput ng relevant questions under each 7 public health ethic principles na sinabi ko sa inyo. And then, be able at the back of your head, kasi magiging group po ito, think about, is it going to be, pwede mo pag-isipan kasi yung mga sagot yan. So, the more questions you place under each public health principle, syempre, the more questions you have to answer. But it serves also as a checklist for you. Next would be proportionality. So in this, is the intervention at least infringing of possible alternatives, or are the costs and utility proportional? So I think that's the last principle. So three reasons why public health ethics is important. It is important because it has a fundamental role in public health. Most especially. The shortcomings of existing bioethics. Yung bioethics kasi is usually for experiments and research, hindi napapag-usapan yung public health ethics kadalasan. So, you cannot, well, sometimes you can also use bioethics issues, but not all the time. So, there are shortcomings in existing bioethics principles in dealing with public health issues. And the global relevance of health and public health now more than ever has not, I think it has been overemphasized time and again. And these are the reasons why public health ethics is important. So under the stewardship model, which is a publication by the World Health Organization, governments have the responsibility to provide conditions under which peoples lead healthy lives. And it should not coerce people nor restrict freedom unnecessarily. So dapat may balancing nga po. And it should protect the citizens from harm caused by others. So others who do not wear masks, others who would rather not get vaccinated but still mingle with you. So remember, we are going back na po, di ba? Face-to-face 100% because of the low cases. So be careful of that. You should still exercise the protect people from harm caused by others and reduce health inequalities. Even before COVID naman, we have been emphasizing reducing health inequalities. Protect also the health of vulnerable populations. By vulnerability, I do not mean just the senior citizens or those with persons with disabilities. I also mean those who are migrants, women, children, those who have less in life. So vulnerable din po sila. So other definition of other vulnerable population or disadvantaged groups, you can have prisoners, children, the elderly, pregnant women, the terminally ill, minority populations, persons with disability. I wish to add those who have been displaced by typhoons, volcanic eruptions, displaced by other forms, other emergencies, disasters, those displaced by peace and order situations, who have been living with their relatives. Swerte nga po kung may relatives probably in another place. Hindi siya talaga member ng community mo, pero public health tayo. And you have to care for them. So vulnerable din po yung population na yun. Baka akalahan nyo kasi pagka vulnerable, seniors lang, women at saka elderly. Hindi po. Seniors, elderly, persons with disabilities, and these people. These are all vulnerable populations. So si Dr. Canila, I hope you know who Dr. Canila is. She's our chair. Has may ganito po siyang matrix na pine-present usually. So pine-present niya yung mga health issues sa first column and then inilalagay niya yung principles, public health ethic principles. So there are 7. So you can go on, add 3 more to this table and then list it. So this is just my tip to you. Hindi ko naman sinasabi sa inyo. Baka pwede nyo rin gawin ito in addition to the tip that I have gave you during the Bea Alonso example, which you could use as a tip na ilalagay mo na lang dyan isa-isa kung ano yung mga questions mo. If these are the interventions that you're doing. Usually, ang public health ethics naman happens when there is a public health intervention concocted, developed by the government. It's to be administered by the government in a particular area. Could be local, could be national. So, dapat tanungin mo yung public health ethics side yan. So, ito po yung group assignment ko. Nakalagay po doon sa Canvas ito ngayon sa assignment tab. I have placed a deadline of until April 30, until end of April 30. And my instructions is to produce a case or scenario. So, hindi na ako nag-produce. Kayo na po yung bahala para ma-manipulate nyo ng maigi. Produce a case or scenario showing the greatest number of public health ethics that you could discuss kung all 7 if you can. So it's really a challenge for you kung mapoproduce nyo yung all 7. Kung hindi naman, konti lang, paramihan na lang po kayo. Anybody who can reach 7 is natama kasi pwede mong ma-reach yung 7, mali naman. Discuss po natin next week. So produce a matrix to show how many checks you have in your checklist. Ano pong checks yung checklist? Refer to the lecture. The questions that I've asked is that part of that checklist. Developing the questions under each public health principle. That's all for the lecture for today. I think this is the last slide. Questions, you might email me, or better yet, you might ask the question now while nandito po tayo, live tayo. So ano po, I'll stop lecturing. So I think it just took 1 hour. You could actually talk to your group na ngayon if you would like to do. Iwan nyo na lang yung dalawang, I think may dalawang absent ngayon. May absent po ngayon eh. Hindi naman tayo 3 tao lang. So kayo po, pwede kayong mag-group na kayong 3. If you'd like to have that group, I will respect that. And then present next week very briefly. And upload it po before, again, it closes. Baka po mag-close na naman yung mag-close na naman itong Canvas, maabutan na naman kayo. So if you have questions po, please feel free to ask about the assignment. Kayo na po yung magpo-produce, fictional, do not name names, but paramihan po ng public health principle na mapoproduce. Ba't ko kayo pinipilit gumawa niyan? Kasi itatanong po yan sa finals. So, para ready ka na. Tapos tatanong mo sa hindi naman inaral namin yun eh. Ay wala, pina-assignment ko nga sa iyo eh. So, dapat alam mo yan by this time or by next week. Questions po? If none, ready to dismiss and convert the recording para ma-upload ko na nga doon sa ating Canvas din.
Doc, question po.
Go ahead
Christine
po.
here po. Bale, kami na po magde-decide kung sinong kagroup po namin for
For this one. Ako, ang advice ko kayo ng 3 kasi kayo na nyo, bahala yung mga absent mag-isip sa buhay nila. Unless naaawa ka, sasama ka dun sa na-absent para ikaw kasi yung resource person dun kasi ikaw yung naka-attend dito.
Pero yun po, yung remaining time po ba ngayon pwede po namin
Yes.
gamitin 3?
Opo. O pwede ko namang I will just leave the meeting. Kasi dalawa yung choice ko dito. End the meeting or just end I will leave. So I will assign one of you as the host. Para ikaw na yung magsarado na tawag ko dito. Ikaw na yung magsarado ng tindahan sa 3 o'clock.
So, classmates, okay lang po ba na gamitin po natin yung remaining time to discuss po or prepare nyo po yung other kasi baka may mga busy sa work din.
Sa akin po okay lang na ma-discuss natin today.
Sa akin din po. So, if okay lang po, siguro po ganun na lang po the day natin
Sa
discuss.
Ayan, ginawa ko pong
okay lang
host.
din po sa akin.
Ginawa ko pong host si Ma'am Dayan o gawin ko na lang kayong mga co-host. Ayan ha, okay na yan. Hindi ko na pala ako, pag nalipat ko na pala yung host, wala na akong powers to make anybody out. So kayo na po yung bahala. Alis na po kami ni Doc Patrick. But if you have questions at any point na nakalimutan nyo lang i-ask, WhatsApp po. Andun naman kami.
Okay po.
Thank
So,
you po.
pero self-explanatory, I don't think mahirapan naman kayo. Madali lang naman yan. I just would like you to see kung paano po yung mga ilalagay yung question. Baka yung justice nandoon sa Maleficent. Mali yun. So, dapat tama yung question mo doon sa kung ano yung principle. Yun lang naman hahanapin namin. Pero, depende nga po yun doon sa scenario nyo. Hindi ko alam kasi kung ano yung mapipick nyo na scenario. Be specific in your scenario. Usually, ito pa isang tip. It's an intervention introduced by the government. Ang government lagi nagmamabuti yan. So, meron siyang intervention na gustong i-introduce. Yun. May ethical issue ba doon? So, pick ka ng konting controversy na ini-issue ni Mga controversial dyan usually could be sexual, could be, ayun nga, yung bubutasin mo ako, may gagawin ka sa akin, kukuha ka ng dugo, mga ganyan. Yung mga controversial dyan. Yung something that will interfere with my privacy. So, yung ganyan. Okay? May added ka, Doc Pat, if ever?
Wala naman po. I just do agree na perfect examples po lagi ang mga government interventions. Kasi laging, it always stems from good intentions, pero more often than not, nag-overstep. So laging may nagiging issues and ethical dilemmas sa mga ganyan. Usually mga mandatory stuff, yung mga ginagawa po nilang mandatory, Dengvaksha, it's a good idea. If you look into Dengvaksha, mga ganyan po, no, yung mga interventions na sometimes, ayun, good intentions po siya, pero yun, sumasobra.
Ayan,
So yun, just look into that.
Hahanapin lang naman po namin yung checklist ninyo. Ibig sabihin, for academic po ito eh. So, ibig sabihin, usually kahit i-present mo yan sa Department of Health, hindi naman nila pinapansin yan. Basta tuloy pa rin sila sa kanilang program. Ganun naman sila. Pero kasi dapat po yan. In the international community, malaki na po yung talk about public health ethics. So, dapat aware po tayo. So, I think it's Dr. Pat and my duty to inform you about this as part of us being your faculty coordinators. Yun po. Yun lang po. Maraming salamat. Sige, hindi na kami magte-take ng time ninyo. I'll leave.
Baka mahiya sila, Doc, na
Oo.
mag-usap.
Boss na ikaw na yan? Oo, tama ka, Doc Pat. Babay na po kami. Happy weekend po sa inyong
Sige
lahat.
po, happy weekend. Thank you
Bye.
po.
Oh.